Good afternoon, class. My name is Michael Broman. I'm the Anesthesia Department Flight Chief at Eglin Air Force Base. My partner for this Tech Talk will be Mr. Juan Rodriguez, the Operations Program Manager at the Naval Medical Modeling and Simulation Training Department. Today, we will be talking about the battlefield trauma simulators. Specifically, our Tech Talk will be on the evolution of the multiple amputation trauma trainer, better known as MAT. Before we start, we will mention that the views of this presentation do not represent the United States Navy, the Uniformed Services University of the Health Sciences, the Naval Postgraduate School, or any specific technological company or entity. During this presentation, the objectives which will be covered include defining what an amputation is, introducing our listeners to MAT, which stands for Multiple Amputation Trauma Trainer. We'll look at MAT's abdominal casualty expectant capability, as well as his packable hemostatic wound trainer capability. Then we'll look at how MAT is being used today and how MAT's being implemented into different training platforms. And finally, we'll look at what the future holds in store for MAT and other battlefield simulation. The DoD defines a major amputation as the loss of limb at or proximal to the wrist or the ankle, and proximal meaning at or nearer to the central portion of the body.
The multiple amputation trauma trainer was launched back in 2009. It was developed by K-Force Government Solutions, also known as KGS, but they had some support from the special effects industry, and a gentleman by the name of Jamie Heineman, some of you might know him from the show of Mythbusters, had a lot of input into the MAT. The intent of the MAT, which was U.S. Army jointly funded R&D, it was really to train our soldiers and medics to take care of this type of injuries out in the field and to save lives. The MAT meets many of the MAT lower especially meets many of the deficiencies in training. And one of the advantages of this is it's just a full motion animatronics. You see this thing out in the field with the smoke and sounds and smells, and then you see this mannequin moving out there, and it has very realistic arterial bleeding. The pulses, in my own experience, they're very realistic. And when you apply the tourniquet on it, it really responds very well. And the one thing that I really liked about it on the MAT was that I was able to control, with direct pressure, which adds realism to the whole training. One of the things that I've seen this MAT being used is with human actors. The human actor obviously adds that immediate response that no mannequin will ever do. So the use of the hybrid with the MAT is very, very impressive. The tissue is the realism is obviously it's not the same as the human skin, but it's very realistic. And another impressive thing on this is the durability. I've seen this MAT being dragged around, and the way it takes a beating, it does very well. The system is really pretty much multi-purpose. For any training, you can use it just by itself if you are trying to do make it kind of a task trainer. And now, of course, it has the bleeding and the movement and all that, but you don't have to take it out in the field. You can have it in a room, train very one-on-one, have a team effort. And the advantage of this is, of course, is one of the evolutions of the MAT, and this will be talking future slides, is that you can use the lower with any of the upper torsos, and that's a huge way you can switch back and forth. With some of the other mannequins, you don't have this, and like I've already mentioned, is you can use it with a live actor. You see that picture on the bottom right of, and I'm sure many of you have seen these pictures in the past, but the live actor is, to me, is makes it so much realistic. So since 2009, like I said, the Mac came out. There's been some, a couple of evolutions. It first started with just being a double amputee, the lower part, but it's also evolved through the abdominal casualty expectant model, and then the packable hemostatic wound train hemo. There's others that are coming up, but these are the two that I find very interesting, and we can definitely use these in any other training that we do out in the field or even in a hospital setting. For the Mat Ace, simple, it does, the eviscerated abdominals, the synthetic tissue. No mannequin is really going to get up to the level of the human skin. One great training tool in this one is the repackable intestines. Now, obviously, there is the reality of, the realism, on this is not as much as we would all want, but I think as technology evolves and this tissue, the vendors work on it, and I know KGS is definitely working on this. Eventually, it's going to be a little more realistic, but at the same time, so much realism could be a disadvantage in the sense that how much of it do we want to be able to reuse this mannequin? So that's one issue that I have with the synthetic issue and the repackable intestines. Oh, it is water resistant. You can soak it. You can soak it, but if you dunk it in in water, is it going to float? No. The mat at the end of the day, it is a piece of equipment that it'll sink. So you have to take care of it. Easy to clean and maintenance after use. That's an advantage, mainly because in a lot of the trainings scenarios, you only have one scenario and you're done. You have one team that goes through this training. You have to be able to reset and do it again. So that's a huge advantage. The next one is the hemo, and the advantage with this one is you can use it just for wound training, nothing else. The venous bleeding at the lower legs, but then at the same time you do have your amputation on the right leg, and that allows you to do a little bit of both. The pressure flows and flow sensors are really good, and if you see on the picture, you have the boot on the mannequin on the mat, and it gives you that other experience of the open bolts and irregular wounds. And here's we're saying that it's caused by explosions, but obviously. Other things could have caused this, but this is a good training, especially when we're doing training to go down range.
One thing that we can do with Matt is we can do skills verification training. And this used to be done through some of the traditional ways of textbook, question, answer, tabletop discussion. But now we can actually have a medic show and validate their skills that they have, and we do this with Matt we see what Matt's capability is, and then we match it up to the training demand, so we can show Matt's worth and what benefit anybody using Matt's going to receive, because those things that we get signed off on our skills verification, such as starting IVs, airway access, basic patient assessment, these are things that in the past may have been talked about to prove validation of skills, where now you actually have to go out and prove that you know how to do these skills with a simulator like Matt. The important thing to remember with Matt is he is specifically designed for combat. So he's a great training aid for deployment training. Um, you know, he's perfect for realistic battlefield trauma scenarios where you want your medical providers to get real hands-on experience and a realistic patient encounter. Um, you know, with Matt, some of the environmental settings that you can control are going to add to the scenario. External sounds that you can create, such as bombs exploding, gunfire, alarms, any helos or airplanes, those type of noises are going to simulate that forward operating base that your medics may be exposed to when they're treating these type of injuries. The fact that you can create external threats where they have to be conscious not only about their patient but actually their surroundings also, because you need to maintain that security, you need to maintain that safety. So being able to provide that type of setting and that patient encounter with Matt adds to that deployment training. And all the injuries that Matt is going to have are injuries that have been reported in battle. Some of the high counts of like amputations and IED injuries that have been calculated and shown, and that's why we do have a simulator like Matt, is because we're trying to take that battlefield research of what injuries we're seeing most common and duplicate that in the simulator to create beneficial deployment training. The other thing with Matt is, the care that the healthcare provider is giving him is going to dictate his outcome. If you do something wrong on Matt, he's not going to react like you would want him to. If you put a tourniquet on, but you don't tighten it up all the way, he's going to continue to bleed out. If you do a needle decompression in the wrong side of the chest, well, that tension pneumothorax is still going to, keep on building up. So definitely Matt reacts to the care that's rendered to him. So, just like a real patient, if you don't do the proper delivery of care with a procedure, you're not going to get the outcome that you're looking for. Basically be the extent of our training for some of the things like tourniquets that we didn't have a simulator like Matt to demonstrate that we actually knew the skills that we were talking about. So with having this capability, we eliminate the need for people to say that they would I would simulate putting O2 on, or I would simulate putting a tourniquet on. By being able to prove that you know how to do that, you take away any gray area, and you take away from having to do the tabletop discussion, because you can actually prove it and you can validate your knowledge through your skills and not through being able to talk through something. Another thing that having Matt does and getting that hands-on experience is it builds confidence. It builds confidence for your healthcare providers that are new to this career field, your phase 2 medical students, your residents, your interns, those people that haven't been exposed too much to patients. It creates an environment where they can build on their confidence and they can practice those skills that they may be timid on. Things such as IVs. IVs are an area that kind of scares some of the med students, and getting that experience on a simulator where they can hone in on their skills and they can get their basic knowledge of starting IVs down and just go through the motions and repeat it a few times before they are put in a real world scenario with a patient. It'll help them build that confidence and get rid of some of that timidness. So it does help out our healthcare providers with building up a, basic skill set before they're actually going in the room for a real patient encounter. And one of the biggest things is things such as tourniquets and handling an abdominal wound and stuff like that you're going to see in battle. MAT can eliminate a medic provider being exposed to that for the first time when they're actually in battle. My first time putting a tourniquet on was actually a real-world combat scenario in Afghanistan. We didn't have a simulator like MAT back then, but now that we do, we have this technology where we can make sure that our medics are getting this training and being able to get a hands-on experience before they're put in that real-world scenario for the first time. Implement MAT into like your national certification courses. Courses such as EMT, TCCC, ATLS, that you have to pass a assessment to get that recertification. MAT actually provides that real-world experience where healthcare providers are proving that they have that knowledge and that they deserve that certification to go along with their medical prowess. Our EMT, you can use this straight into the skills assessment for the trauma scenario. The controlling the bleeding, to getting the patient on the long spine board, the patient assessment, airway, everything you need to pass that assessment. There's a capability that MAT has that you have to be able to demonstrate on MAT to be able to pass the scenario. TCCC, the Tactical Combat Casualty Course. This simulator was designed almost specifically, perfectly for this course. TCCC blends in that combat atmosphere with the healthcare portion, so you do have to be conscious about your surroundings, and you do have to treat it like a combat scenario because you do have that environmental setting of the noises, of the smoke, of the airfield, of the enemy combatant, and you add that into that patient experience, and you let your medical providers see what it feels like to be in that environment so they can practice with a sense of urgency and get their skills down when there's a little bit of pressure on them. And then ATLS, just like some of the other courses like ACLS, implementing Mediman into it to run their mega code. ATLS, you have that advanced trauma life support, your doctors and your residents and stuff, and they're actually practicing in a real world scenario, just like your medics with EMT and TCCC. The capability that MAT has is that it can be used in orientation for medical students in your medical treatment facilities with educational programs. The first patient that your medical student should be having hands-on is a simulator. What this does, it helps indoctrinate them into a stressful environment. It helps them build up their skills to remain cool under pressure, and it helps build confidence up so they can basically hone in on their skills that they've got knowledge about through books, through lectures, but now they get that hands-on where they can actually practice and get their routines down with stuff like starting IVs, patient assessments. It also gives them the opportunity to stabilize high-risk, low-occurring injuries such as amputations, needing to start a cric, dealing with abdominal eviscerations. Being able to get those skills down in practice and learn how to treat as you go along on a simulator is going to help provide better providers which are confident in their skills. And when you have that confidence and you have that real world hands-on knowledge base, it lowers the ultimate overall risk to the patient, and it also improves the quality of care that they're going to receive. So looking into the crystal ball and figuring out how we can increase Matt's capability, and see where the future of battlefield simulation is going to go to. We needed to get input from the users in the field. And one of the main users of Matt that have incorporated it into a TCCC class is the Tom's Lab at Herbert Field. And right now, they've been helping with the production of the 3rd generation of Matt. And some of the things that are evolving on Matt, which seem like, not that big a deal of things, but they really are in the big scheme of things, and they're really going to provide that realistic side to the training that hasn't been there before. Since Matt's a more rugged simulator, the pupils that they had on Matt wouldn't be able to be electrically dilated. You would have to manually switch them to show if it had a blown out pupil or show if they weren't reactive to light. But now, they've been able to evolve the technology, and now the pupils on Matt can dilate, and you can do the Pearl test. And this is so important because a lot of your battlefield patients you're going to see are going to be, blast victims. So the potential for TBI is going to be there. So being able to determine their neurological deficiencies by doing tests like the reactive delight and stuff like that is going to go a far way and helps the medical provider get that sound basic practice down of doing those tests. Another advancement that they've made is modifying their Crike site. What they've done is they've been able to put a blood patch underneath the site of where you're going to cut into to put the Crike. So for the provider, they're going to get that realistic blood return and that initial, burst of blood when they're cutting in, which before when you would cut in, nothing would be there. So you're just cut in and put in the Crike with, no blood, no nothing. Now you're actually going to have that blood that's there. So you're going to have to clear that out. And so that's another advancement, which is going to turn our medical providers into more sound tacticians with what they're doing. And then, you see the IO access. Being medical, we practice IVs all the time, and we get IV access way more than we do IO access. So not having the access to doing IO training and not being exposed to starting IOs, you have this capability now where people can be exposed to it and they can practice starting them and they can get their skills up and be more comfortable doing IO based fluid resuscitation. And having that capability is just going to boost that, because in combat you are going to have to start IOs, and like I said previously, your first time doing some of these procedures shouldn't be in combat. They should be in a simulation lab, and IO is definitely one of those procedures which we can have our first time doing it in a simulation lab than on the battlefield. And then going into the future, one of the very technology breaking, pretty cool things that's out there now is a K9 simulator, which you can add into scenarios in TCCC. In the actual course curriculum for TCCC, they've actually started to have K9 training implemented, because for years we've been transporting and treating K9 service dogs just like we do the service member. Um, I had many aeromedical evacuation missions where we would be transporting a service dog. And so now they're actually throwing that training out there so we know how to treat these service members. And these canine simulators, you can start IVs on, you can start IOs on, you can do some of the basic medical necessities to sustain life on these canines. So looking into the future, they're incorporating some very realistic aspects that a lot of people don't think about. And then looking further into the crystal ball and peering into the future of MAT and battlefield simulation, we can look at the implementation on a strategic level, focusing more on, all medical providers and, not just those that are privileged enough to have MAT and a TCCC or EMT course at their base. We have the opportunity to get members trained up and show them combat scenarios and have them work under pressure before actually going into combat. So being able to provide that benefit from that and from the simulation training, is priceless. It provides medics with confidence and with skills and with an idea of what to expect. The next piece of this is implementing, MAT with the upgrade training for your skills requirements when you're going over and you're validating your members for upgrade training. They have to show that they have proficiency in these skills that are low occurring. So IOs, doing stuff like chest tubes, these areas of medical care that aren't routine, that are usually talked about, can actually be done and performed, and your members can get first-hand experience, not just first eyes experience from looking and reading. They can actually get their hands on. And having that skill set and that experience is going to go a long way in determining if they're actually proficient or not. So definitely adding the simulation into the upgrade training skills requirement will go a long way with developing better quality medics. And then any course that's going to have, trauma involved in it, like your EMT, your ATLS, PHTLS, TCCC, it's almost a no-brainer to have a simulator like MAT indoctrinated into the course. If you're doing any of these courses and you're using the word simulate, as I simulated that I put a tourniquet on, or I simulated that I check the pupils to see if they're active to light, the only word that should be going with simulation should be when you're referring to the actual simulator MAT. Nothing should be simulated as in just saying that you're doing something to simulate that you're doing it. Having these simulators like MAT in these courses will eliminate that. And then lastly, and in closing, the importance of partnering with our civilian agencies. As medics in the military, there's a certain level of preparation that we go through and a certain level of understanding that we have that our civilian counterparts aren't exposed to. But now with the threats of terrorist actions and, you know, more and more combat tactics being used by these terrorists in, you know, California, in Orlando, recently in Louisiana, you know, these people that are committing these acts are basically using combat tactics. So our civilian EMS, you know, they need to be able to provide care for these injuries. So, you know, partnering up and having them do exercises where Matt's involved, where they can get their hands on these simulators and get training also. So, you know, our military and our civilian counterparts can be on the same sheet of music when it comes to taking care of injuries like this. On behalf of Juan Rodriguez, I'm Michael Broman, and I would like to thank you for watching our presentation on the multiple amputation trauma trainer.